Washington, D.C. is my home away from home. I've worked here for the better part of 3 decades as a founder, entrepreneur, policy expert, and author.
Probably the longest title. Everybody sort of shortened it to ONC for sanity's sake.
Mercifully.
Yeah, mercifully.
I've learned leadership secrets from many healthcare executives who understand that Washington is the largest payer and regulator of healthcare.
She said, well, because you'll never get a husband if you do that.
I began interviewing healthcare leaders many years ago because what better way to learn how they think, why they make it to the top, and how they remained there. Think about what was your most challenging engagement.
Healthcare has been the most difficult problem. Let me just say.
We'll talk about that later. "2022 is just around the corner. The new year is a time for reflection on the past year and an opportunity to set new goals and improve ourselves for the next. In this episode, rather than comment on personal goals, we'll explore goals for healthcare. For this episode, we'll hear from 3 leaders about what the future of healthcare could and should look like. To begin, we'll hear from Dr. Kaveh Savafi, Senior Managing Director at Accenture, Dr. Eric Topol, Founder and Director of the Scripps Research Translational Institute and author of Deep Medicine, and Felicia Norwood, Executive Vice President of Anthem and President of the Government Business Division. To begin, let's hear about personalizing patient care with Dr. Kaveh Savafi.
The concept of personalizing an experience separate from the biology. And that's one where we are going to be able to borrow lessons learned from outside of healthcare and other industries, other services and product industries, which have already recognized that that you need to think about your customers much more individually. As Gary, you described in your book, N equals 1, markets of 1. Healthcare is about the most perfect example of a market of 1. The biology alone makes you a market of 1. But then you superimpose whatever your individual preferences are, and the probability that 2 people want the exact same care experience is 0. But the ability to personalize it requires 2 arms. The first arm is I need to know you in a way that is very context specific, and that has not only understanding your illness and your preferences, but there's a time series attached to that. But even if I do, the experience is still very monolithic unless I can figure out how to give elements of it that you can give you some level of control and give some level of variability, which is one of the reasons why I think not just digital data, but digital platforms and software are so critical to this conversation, because it allows us to convert the care experience into a blended physical and digital one. And it is that blending that allows us to create hyper-personalized experience in addition to the personalization of the biology, which will come from the clinical data part of it. So both of those are going on at the same time.
Each patient is unique, biologically and in terms of their expectations for the health care that they seek. In turn, each individual requires a unique patient care experience, which presents an opportunity and a challenge to the provider. Next, we'll listen to Dr. Eric Topol and the opportunities possible with artificial intelligence.
There's a myriad of opportunities with AI, and we haven't scratched the surface, really. I mean, there's a lot of back office operations that could be replaced with AI. Human scribes. We have something like 60, 70,000 human scribes that go into a clinic visit with the doctor so that the doctor can actually talk to the patient. Well, I mean, really. We don't need that. We should have synthetic notes, and that is much better than the notes we have. So there are all these different ways that we can implement different types of AI in our daily practice of medicine to not just save costs, but deliver better care. But also the idea that we get to have more time with patients. That is the gift of time. And we should be, I look forward to the day when health systems in each city are competing with each other for giving time for patients and doctors to come together, not 7, not 12 minutes, but much more. That time together is a critical metric that we don't have right now.
AI presents many opportunities, beginning with the back office. It's also ideal for improving the patient experience, such as strengthening the physician-patient relationship. we'll see continued progress in applying AI to clinical care. To wrap up, we turn to Felicia Norwood and the most important aspect that needs to be changed in our healthcare system.
I still think it's too complex. If I could snap my fingers, I'd make it simpler. Our mission, we talk about improving lives and communities, simplifying healthcare. That's the part we're still not there yet. When I think about the complexities that are associated with just understanding healthcare, if you've even gone on to Medicare.gov during this period of time of open enrollment for Medicare, it is not easy. I have, family where my task at Thanksgiving will be to walk individuals through all of my mother's sisters, whether they do a Medicare Advantage plan or MedSup. But it's not easy. And even Medicare.gov is so complicated. So I do think we still aren't where we need to be around simplifying healthcare, particularly for the people we're trying to serve. So that's still, I think, a responsibility of all of us, payers, providers, health, you name it. That is still to me, that holy grail of trying to continue simplify this process, make it easier to understand, and reduce the complexities of navigating this healthcare system at a time when people need it most.
As we work to improve our health systems with new technology and models, we must always keep the individual in mind and consider how we can positively impact their health experience through simplifying healthcare. These leaders propose that we need to personalize, digitize, and simplify healthcare. Personalizing the patient care experience can advance convenience and improve individual health outcomes. Digitization can increase patient-physician face time, improve collaboration within a care team, and decrease administrative costs. Simplifying healthcare can facilitate communication between patients and providers and allow individuals to access the care more easily. We're beginning 2022 with COVID still pressuring our healthcare system. The day-to-day challenges make it difficult to focus on our vision for healthcare. However, the guests spoke to the importance of standing back and envisioning an improved healthcare system, and each playing our part in pursuing it. To learn more about leadership and to grow your own leadership skills, please listen to us as we explore the art of leadership on The Gary Bisbee Show. Episodes drop every Thursday.